Preliminary findings of the Multidimensional Child Poverty Analysis 2025 showed that more than 1 in 3 children in Trinidad and Tobago are multidimensionally poor. It means they are faced with simultaneous deprivation in at least 2 critical areas of well-being, including education, nutrition, water, sanitation, health, and housing. The study was crafted with the technical support of the United Nations Children's Fund, UNICEF, grounded in the multiple overlapping deprivation analysis MODA framework.
Children living in rural communities are even more vulnerable than those in urban areas. Those in female-headed households, larger families, and households where the head has lower educational attainment face disproportionately higher risks. Boys experience slightly higher rates of deprivation than girls, and significantly, children exposed to physical or psychological discipline also suffer greater deprivation.
The Ministry of the People, Social Development and Family Services, in partnership with UNICEF, held a stakeholder meeting on the report, which saw government ministries and youth-centered organizations shed light on some of the problems faced by this country's youth. In his presentation, UNICEF's Global Director of AI, Social Policy and Social Protection, Casper Fasht, underscored the importance of the human capital in a country's development.
The cognitive capital theory says that our skills, our capabilities are basically established in early childhood. The younger the child, the more important it is to give the child all the inputs that the child needs.
Minister of the People, Social Development and Family Services, Vandana Mohit, revealed that by 2026, the child poverty reduction strategy will be finalized and embedded into this country's planning and implementation framework.
The Ministry of the People, Social Development and Family Services will lead this process. But child poverty is not the responsibility of any single ministry. It requires a unified national effort, with every sector contributing meaningfully to a shared vision of equity and opportunity.
Some of the policy recommendations in the report are the development of a sensitization program for new parents, the adoption of a multi-sectoral approach for policies aimed at children, and the promotion of social services targeting vulnerable families with children under the age of 5. Kavion John, TTT News.